the detached calf forelimb for the dissection on the rest of the thoracic limb here. So here we're starting on the medial side. Up here where my hand is would be the proximal aspect, so upwards toward the body. And here we're down towards the foot. Obviously you can see the claw here for the toes. And we're on the medial side, so we want to start with your Flexor Carpi Radialis muscle, which you did previously identify. So that's right here. So start with that for orientation purposes. And then you'll move down through the carpal canal, which you've cut open here and already dissected those vessels and nerves in there. So those you can see here. So that in the calf is actually the median artery and median nerve. They do not change names to the medial palmar as in the horse. So that is different in the calf. So here you have median artery continuing down, here you have median nerve continuing down, and then it will have similar branching to the horse as far as going to the different sides of the toes, but you do have 2 digits rather than 1. So they will be branching differently and they do have different names. So we want you to know them in the horse and you don't have to dissect them all the way to the digits here in the calf. All right, so now we'll look into the carpal canal and pull out the flexor tendons. So I'm just going to kind of elevate them out here with my fingers. And here you can see, I've already cut them, but you'll do that a little bit later. So you can elevate the tendons of the flexors out of the carpal canal and then trace them up, so proximally, up towards the top of the limb here. And so if you pull those out, you'll see that you have 2 parts to your superficial digital flexor muscle. So here you've got 2 tendons kind of coming together down here, and as you move up you can separate out those 2 parts. So there's just 2 parts to that superficial digital flexor muscle. So then the next one is the deep digital flexor muscle, and so here is that thick tendon, and you can follow that up and pull out the muscle bellies from inside that carpal canal as you go up. But you don't need to differentiate the different muscle heads, just know that it does have several parts. So you can pull those apart and see them, but you don't need to name the different heads. So here you'll have deep digital flexor muscle, and then you have a little bit of a connecting piece. So in the calf you don't have check ligaments as you do in the equine, but we do have this little piece that's kind of similar to a check ligament that's right here in between those 2 muscles. So you have it connecting your superficial digital flexor and your deep digital flexor muscles. It's just kind of in between there. It's kind of a check-like structure. All right, so then we'll put those back in there in the carpal canal, and we'll take a look at the lateral side and cranial side. So I'm just going to flip this over a little bit. And remember, you have all of that super thick fascia to deal with in the calf, so don't be afraid to cut through that as you're doing these dissections, because there's a lot of it. So here we're on the lateral side now, and so we'll start for orientation with your Extensor Carpi Radialis muscle here that extends down across that cranial aspect of the carpus. So here's that tendon coming across the carpus. Here I've opened up so you can see the individual carpal bones. You can do that if you want to see those. I've cut through that extensor retinaculum that goes over these tendons here. So we'll see that as I follow the tendons through. So after the Extensor Carpi Radialis, the next muscle as you move laterally, right here, is the common digital extensor, which has 2 tendons and 2 muscle bellies you can see here. And then the next one is the lateral digital extensor. So I just want to start with that one first, and we'll go back to the common and explain that a little bit more. So here is that lateral digital extensor going down and crossing the carpus here and extending down the lateral side towards the lateral toe. So in this specimen, the lateral toe is missing, and they did a toe amputation from a previous surgery on this animal. And so that toe is missing, but this still goes to the lateral digit. All right, so here, that lateral digital extensor is actually going through, which I've cut through so that you could see it. It's very thick. It's this lateral collateral ligament of the carpus. So you can cut through it if you need to, but you can just see that that tendon goes underneath that ligament. So lateral collateral ligament of the carpus. The medial one is not as easy to see in the calf, so you may see it or you may not. Here we'll go back to the common digital extensor. In some texts you'll see that they have different names for these 2 muscle bellies, but we're, for our purposes, only going to call them the common digital extensor muscle that has two heads. So we'll have a medial head here, and more on the lateral side is the lateral head. So both part of common digital extensor, extending across the carpus and down towards the digits. So here I've cut that extensor retinaculum, which you can do if you want to do that to follow your tendons. So you'll extend down towards the toe here and down to the digits. So common digital extensor there. And then we'll flip this over again. We're just going to turn it a little more caudally. Let's get a caudal view here. And so here you can see I've actually cut through my flexor tendons, so you can cut through both of those. Try and save your vessels and nerves if you can, and just kind of work around them. But as you reflect these, is what the next things you want to see are the ligaments in the distal part of the limb here. So I just did one toe that I cut the ligaments on so that you could see them as I reflect these tendons. So if you reflect your flexor tendons, you can see this part is what's holding it in place across the sesamoids. So right here, I'll put it back together for you. This would be the palmar annular ligament going across. It kind of dips in between the digits here, but it's still one continuous ligament across. So palmar annular ligament, and here I've cut through it so that I could reflect my tendons out of there and keep going down. So here, the next ones you have are the digital annular ligaments. So digital annular ligaments are next. You can separate them into a proximal and a distal, but they're right together, so they kind of look like one digital annular ligament. So you can cut through those. And here you see that flexor manica area where the flexor tendons are switching spots, which we talked about before. And then continuing down, the last ligament I want to show you is only partially here because of that toe amputation on this side. So here you can see it on this medial side here. You have this part right here, the proximal portion of the distal interdigital ligament. So in between the toes, interdigital, is the distal interdigital ligament, and that is specific to the bovines. The horse does not have that, so make sure you see that and know what it is. If you want to do both toes, you can. Here I've dissected out some of it, but you can see the digital annular ligament here and the palmar annular ligament here. And if you want to do both toes, you can, or you can just choose to do one toe if that saves you some time. All right, the last thing we want to show here, hopefully it shows up pretty well. If you move your flexor tendons out of the way, you'll see the interosseous tendon or suspensory ligament. Either name is fine. And here you can see it's fleshy, but it's right on that caudal, the palmar aspect of the cannon bone, and sits right against it. And it can look like a tendon, like in the horse, but it also, in the calf, I find it has a little more fleshy appearance and looks like a muscle. But here you can see it's coming down and it kind of branches around and splits for each of the toes. So here you have a piece splitting down to the lateral side. Here you have another piece and another piece and another piece. Sorry, this one is lateral side, medial side over here. But they split for the two toes, the two digits, and so it's a little bit different than in the horse. So just make sure you see where that's coming from. So this interosseous here, and then watch where it splits for the toes. So that's unique to the calf. And then we'll just flip it over so you can see the extensor branch of that suspensory ligament. So you can see it extending here, continuing around to the front, the cranial aspect here, and then you have these extensor branches. So hopefully I can get underneath it. There we go. So extensor branch of the suspensory ligament extending around to the cranial side. And if I tip this a little bit more, we can actually move to the medial side and see the same thing happening. So here you have the medial side coming down across the cranial aspect here. And if I can get the probe underneath it, you can see another extensor branch there of the suspensory ligament coming across.